Hello, welcome to today's webinar. We are about to get started. My name is Thomas Ezra with Alaska Afterschool Network. Our guest presenter today is Barb Pennington. She is the school health nurse consultant. You can see her on our screen now. If you would please go ahead and put your name and organization you're with in the chat box. Also, if you'd like to as well be on our email distribution list, if you're not already, please include your email address. Today's webinar is going to be recorded. It will be also then posted onto our website. A few kind of housekeeping rules. So if you are on your GoToMeeting taskbar, you'll see on the top left corner of the taskbar, there is a button right now in the top corner that either looks like a phone or a microphone. Please make sure that is red so that you are on mute. We'll have opportunities to engage with our presenter throughout that we'll ask you to unmute towards the end of the workshop, but you're also able to put things in the chat box as well. If you are calling in on your landline phone or cell phone, please make sure not to put the call on hold, because otherwise we'll hear your lovely hold music for the rest of the webinar. Before we turn things over, I do want to just share a little bit about the collaboration that brought about this training. So the Alaska Afterschool Network, which is a program of the Alaska Children's Trust, is in partnership with the Department of Education and the Department of Health and Social Services around really supporting the health and well-being of students both in school and during out-of-school times. Part of this grant from the CDC, or Center for Disease Control, is on helping support students who experience chronic health conditions during out-of-school time and summer programs. And how we can better align and support our work across the school day and during out-of-school times. Barb is going to share today's presentation with us, and if you're going to have any questions, feel free to place them in the chat box. Thank you very much, and I'll turn it over to Barb. You're on mute.
Oh, okay. Hi, welcome. This is Barb Pennington. I was on mute. I didn't know it. Okay, so we are getting started. I'm excited to be part of this. Thomas and I got back from a trip in Atlanta where we got some training on healthy schools. And so some of you are on after-school programs and some of you are nurses on the call. So if we could just take a minute and if you could say what your position is, your name, and where you're from. We'll do a quick intro for whoever's on the line. You can unmute yourself.
Hi, this is Marge Cole. I'm the state school nurse consultant in Missouri, and I'm excited to hear this program, Barb.
Oh, thanks. It's so good to hear you, Marge. I know we have Teresa from Fairbanks, and we had somebody else from Anchorage.
I'm Teresa Smith. I'm from Fairbanks, Alaska, and I work at North Pole Elementary.
Great to have you. Looks like we have Wendy. Hi, Lori from Fairbanks, too.
I'm Heather Schloman. I'm calling from Boys and Girls Clubs of the Kenai Peninsula in Kenai, Alaska.
Oh, great. Glad to have you.
Yeah, thank you for doing this.
Oh, sure. Yes, for those of you that are out of state, this presentation was going to be done on November 30th, but instead we have an earthquake an hour before I was set to do this. So we are doing it now. So I'm glad you actually got on the presentation. I'm excited to finally follow up with this. Okay, who else? Do we have any other after-school people on the line?
Yes, Asia Cunningham and Misty Hogberg from Juneau, Alaska.
Great, glad to have you.
Thank you.
And what program are you with?
We're at the Juneau School District, the Rally program.
Great, glad to have you. Okay, well, we might get a chance if you have questions for some of you that haven't introduced yourself, but I'm going to go ahead and get started. So those of you that are in after-school programs, you have a challenge because you don't have a medical person there like in schools. So there are approximately 25% children in the United States, age 2 to 8, that have a chronic health condition. So in your after-school programs, you can guarantee that you're going to see a section of that, probably 20 to 25% of your kids, and hopefully the parents are giving you some health concerns and giving you medication if they need it in your school programs. But it makes it challenging when you don't have a medical person on staff, and hopefully you have someone you can refer to. So we are going to be talking about those children with the chronic health conditions today, and we're going to talk about the 5 most common childhood illnesses and why is it important to help these students. We're going to discuss the medical emergencies with asthma and allergies. I'm going to focus on those 2 today because those are the most common chronic illnesses. And then we're going to talk about some medications that these students would have in your setting and what parent release forms are needed and what policies you need to have in place. And so for the nurses on the line and some of the other school personnel, we are going to have this available online, this webinar. So if you have coaches that you need to teach after school programs, if you have maybe someone going on a field trip, some of you have campfire in your schools, this is some great topics that you can teach your after school personnel. So the most common childhood illnesses, according to CDC, are asthma, allergies, seizures, diabetes, and poor oral health. In Alaska, we have a larger incidence of poor oral health. So those of you, I'm not going to touch on that much today, but those of you in those after-school programs, if you could, maybe if you have a teaching lesson or talk to the kids about decreasing the sugary drinks, that can be a great example, and maybe mentioning that they should be taking care of their teeth and brushing and flossing. That would really help with your emphasis there, not only in schools from their health teachers, but in your after-school programs. So this is some CDC statistics that shows approximately how many U.S. children are affected by chronic illnesses. And I have some statistics on Alaska. It's very similar, what I've been able to collect. I can only collect the data right now from school districts that have school nurses. But asthma is definitely the most common chronic illness, followed by food allergies in our state. And we do have a growing number of type 2 diabetes also because of obesity in our teenagers and less activity. So why is it important to know about this and to help these students? They will be in your after school or summer school programs, and knowing the medical information ahead of time will help you avoid emergencies. So developing a medical plan with your staff. Some of you may be brand new to after school programs, and so this might be a new area for you. Most after school programs do require their staff to have first aid training, so that would be a first step. So that you'll know what foods to serve and snacks will be safe for your students with allergies. And many food allergies start about age 3 or 4. So those of you in daycare programs and preschool programs, it's especially good for you to know how to be prepared for those children. So you want to think about having a safe environment in your setting, both inside and outside of your school, and provide healthy snacks. And if you do have children with food allergies, your parents are probably going to be telling you that. Make sure that you read the labels very carefully in the menus for your students. Peanuts is the most common food allergies. And in normal school settings, sometimes there's classrooms that are peanut-free. There's not schools that are peanut-free here in Alaska that I'm aware of, but it is an issue with some students, and they have peanut-free tables. In your after-school programs, especially if you have anyone with peanut allergies, it's a really good idea not to have peanuts at all to serve as snacks. And encourage all your students to participate in PE, even if they have like asthma. I was a middle school nurse for 15 years, and I was amazed at all the kids that would use one of their chronic illnesses as an excuse, but really the exercise would really help them to stay healthier. So this information, again, is from the CDC website about children with chronic diseases. So emergency care plans are really important, and if those of you in after-school programs could unmute and let me know if you have had an emergency care plan for any of your students that have come in for your programs. Usually a student with asthma might have one, especially a student with a life-threatening allergy will probably have an emergency care plan. So those of you from some of the outskirts areas, do you have you had any emergency care plans for your students there? I'm not hearing anybody. Anybody want to say yes or no if you have? You may be having some. Okay, Rebecca's on the line. You can go ahead, Rebecca. For some reason, we're not hearing you, so.
Remember to
maybe you can go ahead.
Unmute your microphone by going to the top left-hand side of the GoToMeeting taskbar and clicking the button.
So sometimes if you find out a student has an allergy, you can ask the parent for the form that they give to the school. Rebecca, are you unmuted now?
Barb, so Rebecca is actually the computer I'm on right now. This is tough.
Oh, okay, all right. Okay, that's funny. All right, so I'm going to just go ahead and go on. So in the schools, as a school nurse, we would get care plans for students with, say they have an EpiPen in school. So we would know what to do and what the plan is and what hospital to take the student to. So if you have a student in the school that has one of those life-threatening allergies, make sure you ask the parent for a care plan. So I'm not going to talk a lot about diabetes and seizures, but I am going to just mention that this little quick sheet is a great sheet to have on hand, and we'll have a copy for you so you can print in your medical books. But to know if a student has low blood sugar, if you have any diabetic students, the parents are probably going to be really concerned about you knowing about their medical condition. But I love this sheet, and I've used it a lot in school, and my teachers have used it. And it's a really good way to tell if you have a diabetic student when their blood sugar is starting to get low. They might have some of these symptoms. If you do have a diabetic student, I would make sure if they're not very well controlled or if they're new, that you have someone always monitor them if they're starting to have low blood sugar, and don't let them go any place by themselves, because sometimes they just become a little bit disorientated, and we've had students walk out of the school before without being escorted down to the nurse's office. And the seizure first aid is just a little slide that I have in here right now that I just want you to have that on hand, that you'll know what to do in case a student has a seizure. Many times the younger students could have a very first seizure in their summer program, after school program, and school. If that happens and a student has an unknown seizure, you want to make sure that that 911 is called. If it's a known seizure, follow the care plan that parent has given you. I know in after school programs, you always let parents know of any medical concern that you have, so that's a really good policy. But you basically want to make sure a student is safe, and you move all the objects away, you remove other students out of the room because it's really embarrassing, especially for an older student. Place the student on their side, monitor their breathing, time it, and call 911. Unless it was a previously diagnosed seizure that you have a care plan for. Okay, so we are going to focus today on asthma and allergies. And asthma, probably many of you know someone that has asthma, someone that may have gotten hospitalized for asthma, but it's a chronic, lifelong condition of the airways. It has no cure, and we have had students in Alaska that have died from asthma attacks. We've had them die in school. We've had them die out in the campgrounds. Usually those students are not, they're usually little older students who haven't followed their asthma action plan. Maybe their asthma has gotten out of control. So you may have some of those students in your after-school setting. And if you have a student with asthma, it is really a very good idea to make sure they have their own personal inhaler with them. I know in the after-school programs, you have your staff that carry all the medications, but that student needs to have access to his inhaler. Especially with our cold weather, when it gets below zero, when it gets very cold out, that's a definite trigger, especially if a student with asthma is having some upper respiratory issues. So asthma impacts after-school programs because it is the leading cause of school absences. You might have some of those students missing from your programs, and we want to try to keep those students in school, keep them as healthy as possible. So as I said, they need to have their rescue inhaler with them and available, and you need to know how to help those students too that have an inhaler. So the asthma action plan is available. I'm going to show you a copy of one, but this plan will tell you what the students' triggers are. Like some might have a cat trigger, some might be cold if it gets certain, a certain degree of cold. Some might be from just having an upper respiratory infection. They all have different triggers. I'm just going to show you. I thought I brought a inhaler along, but we're going to have a picture of it. But I'm going to show you what a spacer is looking like. So asthma can be fatal, and even in mild cases, it affects each child differently, and they can lead a normal life. And some of you probably know some of the Olympic athletes that have asthma, so it can be very well controlled. And you could be a significant adult in their life that actually can help them with making sure they're staying on track with treating their asthma. So for the purpose of this presentation, we're going to talk about an asthma episode. It's a flare-up of asthma, and it's not life-threatening. And that can be controlled with medication, just using 1 or 2 puffs of their rescue inhaler and having some support from an adult. And an asthma emergency is when they have an asthma episode that can't be controlled. And that's when you need to be very concerned and would be calling 911. So this shows a picture of what happens during an asthma episode. So as you can see, the picture on the right is showing that the airways are swelling up, and excess mucus production starts to clog those airways. So what's happening is those airways are narrowing, and the mucus production starts, and there's not enough room to breathe. And so that student, many times I've had students get severely anxious, they can't breathe. Just calming them down many times can help. Stress and anxiety can induce an asthma attack. So as you can see, the muscles tighten around those airways and the bronchial tubes. And what the inhaler does, the albuterol, it helps to open up that airway again. So these are some of the common symptoms of asthma. And then if you see the warning signs, this is showing that it's uncontrolled. Probably all of you have heard a wheeze, a student wheezing, an adult wheezing from their asthma. And that's when they're starting to get in danger. Those airways are narrowing. Sometimes it's just a cough that doesn't go away. And I've had students use their inhaler just to help with that cough, so that cough doesn't get out of control. And sometimes they're prescribed an inhaler to help with a persistent cough. They'll get short of breath. You'll see that they retract in their abdominal cavity. and they look like they can't catch their breath. If they start to be tight in the chest, or I've had students, especially the younger students, when I worked in elementary, I had a second grader who would come in and just use her inhaler if I turned around, just like 5 or 6 puffs in a row. And I was like, no, that's not what you want to do. So I'm going to talk about how to properly help these kids when they're using their inhaler. These are some of the triggers that can bring on an asthma episode. We talked about that a little bit. Emotions in your children too. Stress, crying, bullying, all of that increased stress and emotions can cause it. And these are some of the triggers that you might want to watch for. We don't use chalk much anymore, but that is a big trigger for some students. Any animals in the classrooms, mold, mildew, which we do have in a lot of rooms here in Alaska. Strong odors. Make sure your staff are not wearing scented perfumes. Don't have the senses turned in your room, turned on. Just watch your art classes and what you're doing. And then, like I talked about, our cold temperatures. The parents will probably tell you if a child is not going to be able to go outside in our below zero weather. Idling from school buses is also a real area what's triggered some of the students if they're waiting outside for their buses and it's very cold out. We do have dust mites, pollens, pretty prevalent in the spring. Some students just get triggered in the spring and fall. And with our birch trees, we have a really high birch allergy in Alaska. And then smoke in our summers. If you have summer school programs, we always have to worry about the wild fires that will be out there. Okay, so this is a picture of an inhaler, and I thought I brought an inhaler along, and I brought a little Akubi, but I'm just going to show you what a spacer is. Okay, so this is a spacer, and we're going to say this is an inhaler right here. And so the student, as you can see in the picture, that little opening, many students have a spacer, and they would just put this spacer right into that opening. And then actually the spacer goes this side, the little opening goes in here, and then they're able to put this in their mouth. And the spacer helps that medication to be in this holding chamber, and then it's used more effectively. And what I do with especially the younger students that are maybe not used to using their inhaler, but they're gonna take a breath, breathe out, and then breathe in, and then I count with my fingers with them. 1, 2, 3, 4, 5. And they're supposed to hold 5 seconds. And I'm getting a little feedback here, Thomas. But so anyway, they want to hold that in and then breathe out, and then make sure that you time them for 1 minute. They're not supposed to be using it just 2 puffs right in a row. It's not as effective, and the medication does not get into those airways as it needs to. So especially with your younger students, please monitor how they're using their inhaler. The albuterol inhaler is the medication that's called the rescue inhaler. And I have had students that come and bring the wrong inhaler to school. So the other inhalers have a corticosteroid in them, and they are meant to be used twice a day, and they should not be brought to an after-school program. It's possible they would be brought to a summer program if you're having a camp like overnight, a couple nights in a row. But sometimes the students are confused about what's their rescue inhaler. So I would make sure that when you talk to the parent and they bring in that medication, that you ask them, is this their rescue inhaler? And just check to see if it's some brand of albuterol. And this is very, very effective. And usually the orders will say that they can use it once and they can use it 2 puffs, and then if they need to, they can 20 minutes later use 2 more puffs. Usually a doctor's order, and the parent will help you with knowing when you should call the parent, call for an emergency if the inhaler is not working. But usually that's a guide that you can have. And again, it's a metered dose, and the new inhalers actually have the number on the side. Make sure there's still some medication in there. It counts down from the maximum dose down to 0. So make sure when you get that inhaler that you look at and see how many doses are left. And ideally, the parent should, if a child, probably like 3 to 5% of your kids will have, that have chronic disease will need their inhaler, like at school. Like say for instance, in my middle school, I had 25 kids with asthma, and only like 2 or 3 of them had issues where they really had to come in on a regular basis and use their inhaler. So you'll get to know your kids and make sure you're in good communication with your parents on that. Thomas, do you have anything to add on that, on the asthma issue?
Yeah, so this is Thomas, and I would say one of the other pieces of good policy and procedure is anytime that a young person in your program is administered any form of medication, whether it's their inhaler or other medications, that should be documented in a log journal. So that way you're able to really monitor the trends of that student and ensure that you can start, as a staff, work towards helping that child better manage their chronic illness. As well as that should also be just a simple note or documentation that you're also passing along to the family so that they have a better sense about the health and well-being of their child during your out-of-school time program.
Okay. So basically, yes, we're going to talk a little bit about documentation. In Alaska, we do have a self-carry law that allows the students to carry their inhalers. I think in talking to you, Thomas, you said in the after-school programs, the staff keeps the medication. Is that right?
That is largely dependent on the type of program that the young person is enrolled in. You'll see a variance across the age spectrum, if it's developmentally appropriate for that child or if there are other conditions. And that's something at the end we are happy to help you think through after the webinar and discuss more.
Okay, that sounds great. Usually the doctor will write whether the student and the parent will sign it to on an asthma action plan, whether they are okay to self-carry their inhaler. And they have to agree that they will not share it with anybody else, which can happen in those students that are 5th, 6th, 7th grade. I've had that happen with some of my students. So, so basically, to prevent asthma episodes during exercise, there's students that need to take their albuterol 15 minutes prior to activity. And this is really important for some students, so make sure if you have to set a timer, what you need to do if you're planning an exercise activity, that you remind that student that, okay, it's time to use your inhaler. Especially with our cold weather, especially if you're doing strenuous physical exercise, maybe you're going out playing hockey, playing basketball. Those students, I had a lot of middle school students that really, if they didn't pre-treat, we call it pre-treating when they use it 15 minutes before, they would run into trouble and they would end up in my office wheezing. So basically, keep your quick relief inhaler available and accessible. Sometimes they have to use it halfway through their exercise again. And if symptoms start to occur during activity, just stop exercising and let them use their inhaler. Just a little tip, if you're in a setting and you don't have an inhaler, we now in the school settings have generic inhalers that the students can use if they don't have an inhaler that the nurses can give, but you're in an after-school setting. And I have used caffeine, and caffeine helps to open the airways. I've offered them a Coke. I know it has sugar in it, but that caffeine does help, or hot tea, or if they drink coffee and they sit down and they rest and they just have that hot caffeinated drink. Hot chocolate will also work, and that helps to open the airways. And I've had a number of students that that's all they needed, and they were able to breathe normally again. So an asthma emergency, I've had a number of teachers that lay their kiddos flat down, and that is not what you want to do if someone is having an asthma emergency. You want to have them sitting upright, And they will know what position they feel most comfortable in, and do not leave that student alone. So call 911 if the student is having an asthma emergency and they can't control it with their quick relief inhaler. Continued shortness of breath, they're straining to breathe, their symptoms are getting worse. If they can't walk or talk, if their lips are getting blue, those are all symptoms of an asthma emergency where you'd want to call your emergency services. So we're going to talk just a little bit. I'm not going to spend much time on this, but look, if you have students with asthma and allergies, or maybe you're in an older building, look around your building and see if you have any mold or mildew. Just avoid scented products like I was talking about, especially helps your kids with allergies. Minimize your clutter, clean your classrooms. It's best if you don't have a lot of carpet, having more tile and hardwood floors. I know some of you don't have control of that. And it's best to have a no pets allowed rule, or maybe if a pet's going to come and visit, have them outside where it's not in an inside environment. This is a little checklist that's just an example of whoever is doing kind of quality inspection around your setting to look and go through a checklist and make sure everything is up to par, so that it helps all of our kids with some of these chronic diseases. Okay, this is a really good example of an asthma action plan, and that you might get. I like this one because it's colorful and it shows you basically, if you look at the green area right here, it shows you when a student is doing good. Yellow is what we consider the danger zone. It's an intermediate zone. They are, their inhaler may not be working. We don't really use these much anymore, but this is an example of a peak flow meter. And sometimes a student might have that, and they puff into it, and they're going to see what their best peak volume is. It's like measuring the air that goes into the lungs. And for many students, say a middle schooler might have a 250 range. So the yellow range means 20% less than that, their best. And so if they're in that range, I would know that they're not getting that air volume in. And the red zone is when they're only getting 50% of that air volume in. So that's the danger zone, when you'd probably be seeing the blue lips and they're straining, they're probably wheezing. Like I said, it's a serious illness. It's very manageable if they keep treating that. Okay, I guess I'll just go on to food allergies, and then we'll have questions at the end. So food allergies. It's a really big issue, as many of you know, and many restaurants are letting the labels be there, showing what ingredients, and we know what some of the most common food allergies are. So food allergies occur when the body's immune system overreacts to substances in the food you've eaten. This triggers an allergic reaction, and they're more common in young children than adults. Some people do outgrow their allergies, as I've talked to some of the immunologists. Milk, eggs, peanuts, tree nuts, fish, shellfish, wheat, soy cause the most problems in children. They are and can be life-threatening. If you have a student that the parent has told you that they have had anaphylaxis before, we're going to talk about that. Ask them to bring you the allergy care plan that they use in school. There should be no problem with you getting a copy of that. Know what the allergy is and let all the staff know what it is. And have a plan for alternate snacks. Let the parents know if you're serving a snack that the child can't eat, so they can bring a non-allergy alternative. Know the signs of anaphylaxis, and make sure you have their emergency medication with you. And you want to practice too if you have that epinephrine. So anaphylaxis is a severe allergic reaction when the immune system is exposed to a substance that it mistakes as being harmful. And it shows up in all parts of the body, and without epinephrine treatment, it can be fatal. And anaphylactic shock happens when there's severe low blood pressure or shock. And some causes of anaphylaxis is food allergies, We talked about all those different food allergies, insect stings. We do have a number of students that have those bee sting allergies, which will be coming out. We have an early spring here, so although we have snow today, but it's going to be, those bees will be out in spring and fall. So make sure you have an EpiPen on hand, those students that have a bee sting allergy. And medications can cause some, which we don't really need to worry about in the school or after school setting. They wouldn't be getting antibiotics. Some students are allergic to aspirin, so you need to make sure that you have, you only give what the parent supplies. And latex is becoming more of an allergy, severe anaphylactic allergy. These are some of the symptoms. There might be only a few that are present. A throat could be closing, tightening, difficult breathing, a weak pulse, mouth itching, swelling of the tongues, back of the throat. Skin could be itching, redness, hives. Eyes could be red and swelling, and they may have vomiting, diarrhea, or stomach cramps. Now, I'm going to give you an example of a teacher that I had in my school a few years back that came into my office, and she did not know that she had an allergy, but she tried eating some mushrooms, those really big mushrooms. And she had a half of one the night before, and then she had a half one in the morning, and she thought maybe I might be allergic. So she came into my office, and first of all, her lips started swelling, the throat started getting a little bit tingly. I just monitored her. That's only one area. That's what you want to do if something just starts, or maybe there's a few hives. She had a few hives, and then she started getting lots of hives, and then she started feeling like she was going to throw up. So I had to use my emergency EpiPen, and we gave her some epinephrine and sent her on to 911 to the doctor. That's what you want to do if you ever give an EpiPen. Here's an example of a trainer EpiPen. And if you've had first aid, you have probably learned how to use this. The directions are always on it. You want to take the top off. It tells you what to do. You want to use it in, you can see me, imagine this is my leg. So you're going to use it in the outer aspect of the leg, the lateral aspect of the leg. You're going to push it in and count to 10, and then you let go, the needle retracts, you're going to keep that EpiPen. Practice really helps. Some older students will know how to use their own EpiPen, so you could talk to the parent about that. It is always pretty scary for them. I have had a student that just say, can you do it? And it is an emergency. You want to always give it. You never want to wait. It doesn't hardly any side effects to epinephrine. So it's better and safer if you suspect an anaphylactic reaction to give it. I've even had some nurses, some school nurses tell me that they were hesitant to give the epinephrine, just a little bit afraid, but it's worse if you don't give it. If you, like I had a student come in and said, Mrs. Pennington, I think this ice cream in my class had peanut butter in it, and she's severely allergic to peanuts. So it just started, she knew she took it. She had a severe allergy and ordered for epinephrine. So we went ahead and gave the epinephrine, called her mom. We got her into the doctor right away. So those things can happen, and sometimes it just mistakes happen. And so if a student has a severe anaphylactic reaction and they eat that particular substance that they are allergic to, then for some of those students, the doctor would write, just give the epinephrine right away. So you should have an emergency care plan on hand when the student has their own epinephrine, so you know what to do. You could decide if it's anaphylaxis. They should have their own personal dose. Someone in your office, your setting should be trained. Have them sit. I usually don't have them lay down. And they may need a second dose in 10 to 20 minutes. Some of you are in outlying areas where 911 is not quickly available if you're out on a field trip. So you want to make sure that you have a double dose of epinephrine. So there you would have one and another one, usually in a package. There's usually a double that they get prescribed from their doctor. And then they need to be transported to the emergency room. So, and then you'd want to, of course, inform your staff that you gave it and follow your procedures. So, like I said, the instructions for the EpiPens are on the side. You form your fist around it, you inject it, you swing it to jab it, go right through clothes, and hold it for 10 seconds. Saves lives. This is a really good picture of it and what to do, kind of that lateral aspect of the thigh that you want to push down hard. And then you remove it, you massage the area for about 10 seconds. You put that EpiPen away so you can give it to the paramedics. Don't throw it out. You want to make sure you document that. Thomas and I will be talking about that in just a minute. Make sure that you follow your procedure. You describe the symptoms, maybe have someone else there writing it down. You time it, look at what time the symptoms happen, what time you've given the epinephrine, so that you can give that information to the paramedics. Make sure you have all the information. Maybe you can't get a hold of the parents by the time the paramedics get there. So you want to have enough information collected from the parents that you can give to your emergency responders. I just want to let you know that exciting on the forefront here in Alaska is we are working on a training program for you as unlicensed medical staff to be able to give epinephrine to someone that has an unknown anaphylactic allergy, which is about 25% of the anaphylaxis. Our state law allows it, and we have the Allergy and Asthma Association is willing to have a training program, and we just got a standing order to be able to have that, the people that get trained. So this fall, we are looking at getting some of our coaches, after-school staff, schools without school nurses, trained to give epinephrine and have it on hand for a student with an unknown anaphylaxis or a staff member. So that's pretty exciting. We can talk about that in a minute. But Thomas, do you want to mention what are some of the common parent release forms and how we're going to get some of that information to our participants here?
Yes, thank you, Barb. So one of the resources we'll be providing at the end, so I put in the chat box as well, a week after the webinar, we'll have resources posted, which will include the ability to have some of the sample forms for your programs to be able to adopt for things such as use of epinephrine and any other forms of medication that the child may need on program. If you're an after-school provider on the webinar today as well, and you have a sample form you'd like to share out or make available to others, we'd love to have it. Please go ahead and email me after the webinar.
Okay, so you should have some type of parent release form. That's really important. And like Thomas said, we're going to look at some examples. You need to know from the parent what type of chronic illness the student has, how you can help them. The preschools, for the younger kids, sometimes the parents will just tell you, well, we have this in our family, but we've not seen it yet in this child. So just keep an eye on that. And there's some really good resources available. Our state of Alaska, who I work for the state, we have a great website for school health and school nursing, and there's many resources on there that you can use. I have many schools that don't have school nurses use it, and it has training guides for how to give medication, how to manage diabetes, emergencies. There's a great section in the infectious disease management section about how do you clean. We had a bus driver call in and say, I don't know how to properly clean my bus for infectious diseases. So there's some great guides in there. There's some great guides for asthma management. You can contact me if you don't have working in a place where you have a school nurse available. I help and field calls from all over the state. So I'd be happy to help with some of your after school questions you have about health. That's part of what I do. Healthy Schools, CDC Healthy Schools it's a great website for awesome resources. The Allergy Food Network is another one that has some forms available. Just if you don't have any forms, this is one. If you can see it, it's FAIR Alaska. It's on there, and it's a good example of an emergency care plan. You could go to that website and find it. And then SAMPRO is another great website that has some training programs. You could go on there Your staff can take the training programs as well as the CDC website. You can take training from that also. There's lots of good online resources. Some of these sites will have actually training and how to give epinephrine, training about asthma. So you can go on there and get some really good medical information from some of those. So thank you. We are going to open it up for some questions now from some of you or comments. So go ahead and let me know what issues that you're having in your school settings with chronic illnesses, or if there's any other resources we can provide for you. Thomas, did you have more that you wanted to add?
Yes, so one of the things as well that we wanted to let you know, and thank you, Barb, for all the information you shared. It was fantastic. And so one of the partnerships through this grant, again, we are going to be working directly with Afterschool and summer programs, and really looking at how do we support chronic health conditions inside of programs, both for children and for staff. As Barb mentioned, she is open to helping support with some coaching in that, and we at the network as well, and really helping programs figure out really what's the best plan of care inside of your setting. So please feel free to reach out to us. As well, you'll see on the slide right now, but I'm going to put it in the chat box as well. We do have an evaluation for today's webinar. It helps us strengthen the quality of our webinars. It also helps us know what other topics you would like more information on. If you're interested in other chronic disease or health-related topics, please take the survey. We will be doing a prize as well we'll be sending out a first aid kit to your program site as an incentive to go ahead and complete that survey. But at this time, if you have any questions, please feel free to put it in the chat box in the GoToMeeting taskbar, or unmute yourself and ask questions.
Hey Thomas, this is Heather. I'm wondering, what's the time frame that you guys are going to have for working with individual programs?
That is a great question, Heather. I think pretty open for that. I think it depends on what's the need of the program. Right now, the federal grant that right now the state of Alaska has that's supporting this work is going on, I think, Barb, for the next 3 years still.
Yeah, actually, this is the first year. It's 1 of 5 years. So, was it 3 years?
The reason I ask is this came at a really interesting time. We had our staff meeting, so we have 8 sites. And we had a staff meeting just on Wednesday with all of the directors because we had a situation at one of our clubs with a little 8-year-old that has, I can't remember if it's type 1 or type 2 diabetes. It's the worst of the two. And we were having a really hard time working with the foster parent in order to come to terms that she could participate, but that we were keeping her safe and not putting our staff and club liable. And so that particular situation opened up more conversations surrounding the chronic health conditions in our clubs and being consistent and making sure that we're doing our best to be inclusive, but also to make sure that we're not overstepping our bounds as non-medical professionals. So we're interested in, as soon as you guys are able to work with us, we would really appreciate that.
Sure, Heather, I can work with you right away. If you give me your information, I'd be happy to answer some questions and help you with those kind of situations. It's good to have a plan in place for, especially with diabetes, for having your staff trained. And usually in the school setting, we have a nurse come in and train any non-medical people in the care plan and what to do. So we can talk about that. I'm glad that you had an incident come up that
would be great, because it ended up the foster mom was actually pulling the child from the program. She really was not very easy to work with, and we were trying to come to a common ground, but she was kind of hostile. And the school nurse felt like with this particular child's situation that we were taking on more as an after-school program than we should.
Mm-hmm.
So is your contact information somewhere, Rebecca, on here? So I can shoot you an email and we can maybe schedule.
I'm Barbara, and it's right
Barbara,
on.
sorry.
Yeah, it's barbara.pennington@alaska.gov.
Oh, got you right there. I'll send you an email if you don't mind.
Okay, yeah, that would be great.
Okay, thank you so much.
Sure. Other questions, comments?
This is Thomas again. If you could please maybe talk a little bit about, what are ways that the after-school program, so many of our after-school programs are run by separate outside agencies, such as a Boys and Girls Club or a YMCA or a rec center. And so they are not part of the school system. Can you maybe share a little bit of information about what is the best way of kind of engaging school nurses in this conversation? When the school nurses' hours close at the end of the day, how can you engage that school nurse in thinking of the wellness of their students that are transitioning into after-school or summer programs?
That is such a good question, Thomas. We were just talking about that in March. You can chime in after I'm done making a comment. But yes, we are looking at that as part of this grant this year to look at bridging that gap between the school nurses to the after-school programs, because we want to have continuity of care. And I have been a part of that with having an after-school program in my school. And it was one of the teachers from my school who was actually leading it. But yes, we want to bridge that gap and help that there's more communication. It's actually one of the goals that some of the school nurse consultants are looking at as part of this grant. So how can we have a better way to transfer that information, especially like say letting the after school personnel know that, okay, this kiddo has been recently, say, hospitalized for his asthma, we're doing this, and this is how we're helping, and yes, we wanted to get out there and get some exercise, and this is what was happening today. And so we're looking at ways to increase that communication. Marge, do you have any comments about that?
I just congratulate Alaska for being the first to offer this kind of training for your after-school staff and school nurses, Barbara. It's really, but we're all listening to you because you're ahead of all of us.
Oh.
And I will share with you something we just finished here in Missouri, and that's a set of links to national training information about the chronic diseases you just discussed, and have a look at it and see if you want to share that with your school nurses and after school staff. So I'll send it over. We just finished with it, and I would love to send the evaluation link with it so that if any of your school nurses use it or your after school staff, they'll let us know. And so then we can see what Alaska says as well as what Missouri says about it. Okay.
Great.
You'll get it this afternoon.
Okay, thank you, Marge.
And hi, Thomas. Nice to see you as well.
Great seeing you as well.
Anybody else have any comments? Any of our school nurses on the call, have you worked with your after school programs at all? How about our Fairbanks school nurses or Kodiak?
All right. And we have Lori who said yes, she has.
Okay.
Lori, do you want to take yourself off of mute and kind of share what that kind of partnership or collaboration has looked like during out of school time?
Oh, okay. Michelle from Kodiak doesn't have a mic.
Hi, this is Teresa. Since I'm a new nurse, I'm definitely going to work on this with our after school program. Thank you this is great. Thank you so much.
And Teresa, are you in Fairbanks?
Yes, that would help. Yes, I'm from Fairbanks.
Okay, yeah, that sounds great.
And
Yeah, something we have to think about, I think, as school nurses. Go ahead, Thomas.
I was going to say to any of the school nurses who are on the call too, or any of the after-school providers, I'm happy to help do that bridge building as well. I'd say for each of us, even though you may not know that there's an after-school program in your community or that might not occur directly at your site, frequently there's an after-school or extracurricular activity that many of your young people are being engaged in, whether that's sports programs or robotic program after school, dance, theater, kind of a wide gamut. We're happy to help connect you to those resources on how you can support young people.
There's March. Oh, so good to see all of you from all over the nation. It's pretty exciting. So, okay, any other comments, questions? It was great to have all of you, and I would love to hear on the SurveyMonkey if you have something else that you would like us to cover. I would love to do this again in the fall when school starts, or Thomas, we can see if there's some summer programs that maybe would like some of this information. We can work with you. It would be great. So anything else, Thomas?
Great. Well, again, we just really appreciate all of you joining us today for the webinar. This is, you'll start seeing more webinars from us in a quarterly fashion. We'll be producing webinars on a wide variety of topics. Again, please take the survey that is available in the chat box or on the screen. That definitely helps us in knowing how to connect resources to you. As well, the part that I would like to really share out to everyone is thank Barb so much for joining us today and sharing her expertise and knowledge. We're thrilled to have this partnership with the Department of Health and Social Services and Department of Education and Early Development to really advance and coordinate care for young people during out-of-school times. So thank you so much, Barb, for joining us. I'm really glad this time we didn't have another earthquake to interrupt the training.
I know. I held my breath today. I was like, I hope I can get there.
The last thing is, as Barb said, the state is looking at starting to do a pilot around having EpiPens on hand at programs for youth who do not have diagnosed anaphylaxis or life-threatening allergies. If your program is interested in that, please, again, email me. My email address I will put in the chat box as well. It lists me as Rebecca, but this is actually Thomas. And we would love to be able to get you on that list to start exploring what that would look like inside of your program. So please feel free to reach out and connect with us further.
Thank you all.
All right. Thank you, and have a great afternoon. Bye-bye.
Bye.